Hi, this is Colleen Parsons with your Neurological System Assessment, Part 1. I'm actually going to do Part 1 and Part 2 in this section, in this audio. Review your anatomy as always. So when we're looking at the skills assessment for neurology, there's quite a bit to it, and there's a lot that you need to memorize. So let me turn this on here. Laser pointer. Okay, so of course you have to do the top three things, and then you're going to do your assessing your orientation, which you're very used to doing. What is your name? What is your birth date? What is the date? Who's president? Or where are you? Those sorts of questions. So that would be an orientation. Test of memory would be more of who's president, what did you have for breakfast, or what did you have for dinner last night? And it's okay to ask those questions, and you'll hear other staff asking those questions, other nurses or physicians. However, if you can't verify what somebody had for dinner, that's not your best question, because they could answer absolutely anything. And I have a story that hopefully I'll remember to tell during class about that I had with a patient once upon a time. So ask things that you can verify. What kind of car do you drive? Those sorts of questions would be interesting if you can figure out how to verify them. So you also want to give them a test of general knowledge. Who was the first president of the United States? Who was the 16th president of the United States? When was World War II? The early 40s? Those sorts of questions, okay? So we're now moving on to cranial nerves. You have your olfactory nerve. There are very specific things that you need to do with these, and I'm pretty sure that Debbie went through all of those in the video. If not, we'll go through them in class, but there's very specific actions that you need to take in a specific way in order to adequately assess these cranial nerves. Then we need to test balance. We do that with a Romberg test. We're going to test coordination, and that would be something like touching your finger to the end of your nose, kind of a thing. You would be holding your finger out that way. And one sensory test, putting an object in somebody's hand and asking them, what does that object feel like? There's a few different tests that your book goes through. Then you're going to do the tendon reflexes, and these can be difficult. You're not going to get all of these. With practice, you would, and I hope you do choose to practice once you get them, and you can't get them on all patients, quite honestly. So you're going to do the biceps, the triceps, the brachioradial, sorry about that, the patellar, the Achilles, and one superficial reflex, and that would probably be the Babinski reflex, or not that. Well, we'll talk about superficial reflex, but the abnormal reflex would likely be getting a positive Babinski reflex. So we're going to look at all of those during class and during Debbie's video, and we'll go from there. There are some great, there's quite a bit of great information for you online in the Jarvis text if you choose to go there. Again, I have these little blurbs here if you want to listen to anything, but I'm just going to flip through these. If you ever do work with the brain, you'll get to know all of this. The neurons are just so important, and your reflexes. Cranial nerves, we're going to be doing, like I said before during your test, we'll be getting all of these. Spinal nerves. Developmental competence in infants. Unless you actually work in pediatrics, you're not going to do this because their neurological system isn't even really completely developed at birth, and hopefully whoever is teaching pediatrics will go through some of this with you. With adults, atrophy and a steady loss of neuron structure in the brain occurs, and you will see a general decompensation in neuro response through time, especially with an aging adult. Genetics, so if we're talking about strokes, that will affect a lot of neurological presentations. And if we are talking about MS, Lou Gehrig's disease, which is ALS, there's several neurological diseases that you'll see. Some of them have a genetic or racial or ethnic aspect to them. Geographically, you will see more MS above the higher in latitude we get, so the closer to the North Pole or South Pole you get, the increase in MS. And they're attributing that right now to not getting enough vitamin D. At least that's one of the theories. That's the end of part 1. So now we're going to rapidly just move into part 2 of your neural system with your subjective questions. This is where, again, you're asking about headaches. Headaches are a big deal, or a head injury. So you're going to ask, have you ever had a head injury? If, when, where. So when you ask about that before, concussion is a big part of what we are talking about for assessment, especially concussive syndrome with the neurological assessment. Dizziness and vertigo, seizures and tremors. We're going to ask questions about weakness. Do you have any problems balancing or walking? Any problems falling? Which way do your legs seem to give way? Do you have any clumsiness or clumsy movements? People will actually make jokes about being clumsy. They're just so clumsy, but that can have a neurological basis to it. So asking them, when did that start? Have there been any changes over time? That will all be important. Numbness and tingling is important. When did it start? Where do you feel it? That's a neurological sign. Difficulty swallowing, difficulty speaking, any significant history. Do you have a history of a stroke, spinal cord injury, meningitis, encephalitis, congenital defects, or alcoholism? Some congenital defects would be spina bifida. That's one that jumps right out at me, or anything else that involves the spine. Environmental and occupational hazards. How about lead is a very big deal that can cause delayed thinking and mental retardation. Exposure to insecticides, organic solvents, they can all wreak havoc on the neurological system. Are you taking any medications now? Sometimes they have an impact on your neurological system. But of course, how much alcohol do you drink? How much each week? How much each day? That will lead to, so if somebody is dependent on alcohol or is subject to drinking a lot of alcohol, then that can cause delirium tremens if they decide to come off of alcohol, or if they're hospitalized for long enough that they are actually going through withdrawal. So how about mood-altering drugs? Marijuana doesn't create too much, but it can numb you enough that you're not really experiencing the full effects of your other neurological problems. However, as you know, with CBD oil, they are finding a solution, or at least a significant impact to the relief of seizures, which is a neurological disorder, with a derivative of marijuana. So you've got cocaine, barbiturates, and tranquilizers here as well, and they will all impact your neurological data. Infants and children, did mom have any difficulty during her pregnancy? Was she exposed to toxemia, alcohol, drug use? This is where we'll talk a little bit about, I think this is where we'll talk a little bit about what alcohol does to fetuses and how the children are born. And was the infant premature or full term? Was there any birth trauma? What were the APGAR scores? Those are things that you would ask. Reflexes, you would check a child's reflexes. An infant, you want to know if they're sucking or swallowing. And again, I'm not going to really go into this, but if you see a problem with balance or clumsiness, then you know that you've got to check that out. Additional history, has child had any seizures? Well, we're going to ask that not just with the children, but we're going to ask that with adults. How about if there was a seizure, was there a loss of consciousness? Has a child had any environmental exposure to lead? If you have been paying attention to the news at all over the last couple of years, you know what the lead in the water has done to children in Michigan. Aging adults, problems with dizziness, that's a really big thing, or clumsiness, having difficulty walking. How about if they ever get up at night and feel faint while they're standing to urinate? How does dizziness affect your daily activities? Are you able to drive safely and maneuver within your house safely? And that's going to be pretty subjective. What do you think they mean by safely, and what do you mean by safely? They might mean two different things. I have a friend whose mom just gave up her driver's license at 97.5 years old. So I'm not sure that that was the best. Waiting that long was the best thing, but that's what they did. Have you noticed a decrease in memory or a change in mental function? So what are we looking at here? We're probably looking at dementia, and underneath dementia and the umbrella of that is Alzheimer's disease and some other neurological diseases related to aging and how they affect our thinking and our mind. But it isn't just dementia you think is just of the mind, but it isn't. Because of how the brain works, it ends up affecting all of the person's body as the brain atrophies. And that's the end of part 2. Thank you, and we'll do part 3 here in a second.